Hello everybody, my name is Philip Ritchie and I am here to talk to you today about paperless healthcare and the many challenges that go with it as described by Julia Adler-Milstein and David W. Bates in their article Paperless Healthcare: Progress and Challenges of an IT-Enabled Healthcare System. In this presentation, we will take a look at what is currently in place for healthcare information transfer systems and how these are very inefficient and many improvements could be made. We will then look at how these improvements could be easily achieved using existing technologies and how healthcare IT systems or electronic health record systems could change the experience of visiting a doctor's office. Then we will look at the specific pros and cons of the implementation of an EHR system from an economic, structural, organizational, and technical view. Finally, we will look at what barriers will have to be overcome to actually achieve the goal of paperless healthcare. In most doctor's offices, the process of serving a patient relies heavily on reading a chart which has pages upon pages of notes and medical history and other information pertaining to the patient's health. With each patient having a chart, you can see how storing these for the many people that go to a specific doctor's office can easily take up a large amount of space and waste vast amounts of paper. As well as physical restraints on the doctor's office, there are complications with people going to doctor's offices in different areas since their chart has a home in a different location. If a patient has to change doctors or simply has to go to another location for an emergency, the most common form of communicating their medical records is by faxing them, which is a largely outdated technology that is very slow and a waste of paper. In some cases, these records are scanned into a computer at one point or another to send to somebody who will then print them out. Why not keep the records digital and save paper? There are many programs that would allow you to take notes on these documents, and the digitalization of them would make things much easier to read, which is one of the ways that an electronic health record system could lead to less error. There's a lot of room for error when the health system is relying on physical papers and people taking them from one place to another. There are a few places that EHR systems are being implemented and studied. In this article, there is an example that a national cross-sectional study is being done that looks at 17 quality indicators, and they have found that in 14 of those indicators there is no significant difference in performance. They later say that this is disregarding one of the main aspects of healthcare IT, which is the decision support system. In just about all the other areas, an EHR is meant to preserve the use of paper and not meant to immediately speed up the process of visiting a doctor's office. A decision support system is what would improve the performance of practicing doctors because it could help them actually make decisions and increase the likelihood of success in medical procedures. From an economic viewpoint, the initial impact of implementing an electronic health record system is not at all favorable. The system would be costly to implement, and this article shows that in a study of 14 small primary care practices, the initial cost averaged $44,000 per full-time equivalent provider, and ongoing costs averaging $8,500 per provider per year. Another challenge is that there is no surefire incentive program that would give practicing doctors in their offices the push they need to be on board with adding an EHR. In a few cases, the government was offering grants to small practices to adopt this program, and then when the grant money ran out, these offices were ditching the whole system and going back to their old ways. On the other hand, there are many advantages to a health IT system. The most obvious economic advantage is the large amounts of paper that will be saved. Not only will the saving of paper reduce the money spent for the supply, but it will reduce the electricity spent printing out pages upon pages of documents. The reduction of paper consumption will also reduce the need to allocate massive amounts of space for file cabinets and supplies storage. These savings can be put towards much-needed space in offices and hospitals. Along with these physical savings, there would be a lot saved from reducing the amount of errors made. The more people that are in contact with physical documents, having to transport them from room to room and even across the country to other hospitals, the more of a chance there is for human error. There are large studies being done on health information exchange, and it was found that about $78 billion could have been saved because of a widespread practice of redundancy and laboratory testing. A digital world would eliminate this error because everybody would be seeing the same patient information at the same time and changes could be made which would document where and when tests were being done. From a structural viewpoint, the implementation of a health information exchange system would increase the interchangeability between doctors, which would make visits to a primary care physician much easier for the patients. The healthcare system as a whole would increase in speed once an electronic health record system is in place and everybody was familiar with how to use it. The addition of a decision support system would greatly affect the structure of healthcare because any doctor would be able to make critical decisions without the consultance of others. This decision support system would help weed out information and collectively search archives for diagnosis and help choose the correct medical procedure for the patient while keeping their medical history in mind. Although interchangeability would be a good thing for the patients, the ease of health information exchange would make physicians worry about keeping their own patients since there would no longer be any barriers stopping them from quickly changing doctors. From an organizational viewpoint, the benefits of health IT and electronic health resources are obvious. All medical information and records and notes would be easily accessible by any doctor, and all information would be in one place. Physicians would now no longer have to stare at documents and flip through many pages to find the specific information, since electronic documents are easily searchable. Although it would be great to have everything digitalized, many offices are refraining from doing this simply because of the large amounts of time that would have to be allocated to putting all of this information into a database. Once the information is in the system, doctors and all other personnel of the office would have to learn how to effectively use these programs, and operations within the organization will be much slower than usual until everybody has gotten up to the speed with the use of the EHR. The final viewpoint is looking at health IT through technical eyes, and many of these topics are things that we have already covered. There will be less time spent printing documents and less energy spent physically bringing these documents and other patient charts around the hospital or other doctors' offices. EHRs would make information readily available from virtually anywhere, and decision support systems would make medical emergencies or even simple doctor's visits much more quicker and easier. Some negatives from a technical viewpoint would be that there is not currently any user-friendly systems. All systems that are available have to be learned, where in an ideal world there should be the existence of a system that even a physician who has never seen it before should be able to sit down and access and change people's medical history as needed. As far as EHR or HIE systems go nowadays, most are vastly different and all have specific tasks they are meant to perform. Another thing that is made clear in this article is the great resistance that just about everyone is showing to any advances towards paperless healthcare. Most of this could be changed by just informing them of the benefits of implementing a system and how they outweigh the costs. Once people learn to use an EHR system, there will be no need to have constant IT supervision or support, and it will quickly become second nature. The next step toward a national advancement in health IT would be to create a universal system, much like a Microsoft Office suite, where there would be many different programs made specifically for different sized and types of healthcare providers. These programs, although all designed to do different things, would all have to be easily used and information would have to be easily transferred between them. Once people can see that these systems wouldn't be that costly, cash-wise or time-wise, to implement, then they would start to understand the benefits of doing this. Current incentive programs would have to be replaced with new ones that would not only reward people for using an EHR system, but would make them want to keep using it even if the incentive were to diminish. By doing this, there would be lower barriers to enter the world of paperless healthcare, and all health providers would be on board with advancing their health information technology systems. Thank you all very much for listening, and I hope that this presentation provided a simple view into the advancement of healthcare technology services.